Good evening to all. Today we are going to discuss about glaucoma. My class is about glaucoma. Different types you can see. Various factors, pathophysiology, diagnostic investigations, clinical manifestations, etc. So glaucoma is a group of eye disease characterized by progressive damage to the optic nerve. So it's a group of disease that damages the optic nerve. This nerve is responsible for transmitting visual signals from the eye to the brain. It is often caused by unhealthy buildup of fluid pressure inside the eye. So that is the intraocular pressure builds up. It's often called the silent thief of sight because it develops slowly without early signs. So glaucoma refers to many diseases involving the eye pressure or intraocular pressure that increases and leads to permanent vision loss and blindness due to the damage of the optic nerve. So it usually happens when fluid builds up in the eye. So this increase in the intraocular pressure damages the optic nerve. Glaucoma leading to blindness. It's a cause of blindness for people over 60 years old. But blindness from glaucoma can often be prevented by early treatment. So according to the book definition, glaucoma is a group of eye diseases that damage the optic nerve, usually due to buildup of fluid pressure, intraocular pressure inside the eye can lead to permanent vision loss. So this is the picture. You can see a normal eye and the drainage of the aqueous humor in normal fluid flow. Obstruction is not there. But here in glaucoma, there will be obstructed trabecular meshwork in open angle glaucoma. Drainage canal is blocked. So there will be slow flow of aqueous humor fluid. Then in angle closure glaucoma, there is another type. Pressure pushes the iris against the cornea, blocking the trabecular meshwork, and iris and lens stick together. That is angle closure glaucoma. There is another type of glaucoma which is more dangerous because you can see here the intraocular pressure increases and that will damage the optic nerve. That will lead to blindness. So glaucoma, you can see the blocked drainage channel. So due to the buildup of aqueous humor, that is the fluid, so it is not drained properly. Sometimes it will be blocked, and the pressure inside the, because of the fluid inside the eye increases, so pressure also gets built up. So the fluid drainage is blocked, so that will increase the intraocular pressure. That will lead to glaucoma. So here you can see the arrow mark shows the intraocular pressure is increasing. Four major types are there: open angle, angle closure or closed angle, congenital, and secondary. There are different classifications. So main types are open angle and angle closure glaucoma. So open angle OAG, there is the most common form where the fluid drains too slowly, causing a painless gradual loss of sight vision. That is, peripheral vision is lost. So they cannot see on the sides what is happening on the sides of the eye. So angle closure glaucoma, a rare and dangerous emergency where fluid is blocked suddenly, causing severe eye pain, headache, and redness. So primary open angle glaucoma and angle closure glaucoma or closed angle glaucoma. We'll see the difference. That is primary angle glaucoma, open angle glaucoma. It's the most common one. The drainage angle remains open, but the fluid drains too slowly, causing a gradual pressure of intraocular pressure increases gradually. Symptoms: slow loss of sight. The peripheral vision is lost, usually with no earlier warning signs. Then closed angle or angle closure glaucoma, the drainage is completely blocked or narrowed sharply, stopping the fluid from escaping. So the aqueous humor fluid cannot escape. It can develop slowly or happen suddenly as an acute emergency. Symptoms are severe eye pain or ocular pain, increases red eyes, nausea and blurry vision with the hands. So here you can see the picture of the angle closure glaucoma and closed angle glaucoma. So in angle closure glaucoma and that is the drainage will be less. Drainage is not able, the fluid is not able to drain. It slowly it drains. So fully it is not blocked. But here you can see the closed angle glaucoma. The it is completely blocked. Range of aqueous humor is completely blocked. An angle between iris and cornea is too narrow, so intraocular pressure increases very high. But in a normal eye, you can see normal IOP because correct eye fluid drainage through the canal. So this aqueous humor is drained normally, and there is no drainage blocked. There is no blockage of drainage, so the intraocular pressure will be normal. But in closed angle glaucoma, it is completely blocked. So the fluid cannot drain, aqueous humor cannot drain properly. So the intraocular pressure increases due to angle between the iris and cornea is too narrow, and it will lead to closed angle. In open angle glaucoma, the inner eye pressure or intraocular pressure rises because the correct amount of fluid cannot drain out of the eye. With open angle glaucoma, the entrance to the drainage canals are clear but should be working correctly. The clogging problem occurs further inside the drainage canals. In angle closure glaucoma, what happens means it's a type of glaucoma where the iris bulges. The bulging iris partially or completely blocks the drainage angle, and as a result, fluid cannot circulate through the eye and intraocular pressure increases. So it can be acute or narrow. Some children have congenital glaucoma. There is a rare genetic condition where abnormal development of the eye's drainage system before birth causes a dangerous buildup of intraocular pressure. This pressure damages the optic nerve. Without prompt medical or surgical treatment, it can cause irreversible vision loss or blindness to the child. Secondary glaucoma is due to different disease conditions like diabetes, hypertension. So it's a name used to describe glaucoma that occurs as side effect or secondary to another underlying medical condition or trauma. Then secondary glaucoma, different types: traumatic glaucoma, pigmentary glaucoma, neovascular glaucoma, uveitic glaucoma, exfoliative glaucoma. So traumatic glaucoma is, as the name indicates, it can be due to any injury or trauma to the eye. Pigmentary glaucoma occurs when the pigment granules that are in the back of the iris break into the clear fluid produced inside the eye. The neovascular is caused by abnormal formation of new blood vessels on the iris and over the eye's drainage channels. Uveitic glaucoma, it's a swelling and inflammation of the uvea in the middle layer. It happens when inflammatory cells and debris blocks the eye's fluid drainage. So, or when steroid medicines used to treat the swelling raise the pressure of the intraocular, raise the pressure of the eye, that is the intraocular pressure is raised. Exfoliative glaucoma occurs when a flaky dandruff-like material peels off the outer layer of the lens within the eye. So classification, again many classifications are there, mainly two: open angle and angle closure glaucoma. So in that, open angle again divided into two, primary and secondary. Angle closure glaucoma also divided into primary and secondary. So common type of glaucoma is inflammatory glaucoma, neovascular glaucoma, and traumatic glaucoma. So glaucoma is a silent thief of sight. Slowly we will lose our sight. So categories of primary open angle glaucoma: high pressure, chronic or standard. Features a wide range, wide open drainage angle, increases the resistance in the trabecular measure, and high intraocular pressure above 21 mm of mercury that damages the optic nerve over time. Normal tension glaucoma features progressive optic nerve damage and visual field loss, while eye pressure measurements remain consistently within the normal statistical range 12 to 21 mm of mercury. Juvenile onset primary open glaucoma, a rare form that begins between the age of 3 and 40, often linked to specific genetic mutations and frequently presenting with very high eye pressure or intraocular pressure. Primary angle closure disease spectrum. That is, you can see the primary angle closure occurs when the iris physically blocks the eye's drainage system, trabecular measure. It is staged progressively based on iridotrabecular contact and structural damage. So primary angle closure glaucoma, at least 180 degree of iridotrabecular contact where the peripheral iris is close to the trabecular measure. Intraocular pressure, optic nerve and visual fields are completely normal in that. But in primary angle, sometimes the same 180 degree of angle closure with evidence that trabecular obstruction has already occurred, that will cause elevated IOP or peripheral anterior syncytiae, but without glomatous damage. Then primary angle closure glaucoma, Angle closure is present alongside evidence of optic nerve damage and or visual field loss. So, the primary angle closure glaucoma types are acute angle closure glaucoma, intermittent angle closure glaucoma, and chronic angle closure glaucoma. So, acute angle closure glaucoma comes on quickly and it's a medical emergency because permanent vision damage can happen very quickly. Symptoms are severe eye pain or ocular pain, blurred vision, halos, nausea, vomiting, and red eye. Intermittent angle closure glaucoma refers to cases where the drainage system ranges from open to closed. You may or may not have symptoms. Chronic angle closure glaucoma may not cause symptoms at the beginning, but gradually symptoms may develop. Later, it may result in episode of acute angle closure glaucoma and it increase the intraocular pressure with possible damage to your optic. Rubeotic glaucoma is also known as neovascular glaucoma. It's a severe secondary eye condition triggered by diabetic retinopathy, central retinal vein occlusion, and ocular ischemic syndrome. It happens when lack of oxygen in the retina causes abnormal fragile blood vessels to grow on the iris and block the fluid drainage in the eye. Causes are blocked drainage angles, secondary factors, so and fluid pressure buildup and poor blood circulation. So here you can see in blocked drainage angle, the drainage angle between the iris and the cornea becomes lower, completely blocked, causing the fluid to back up. In poor blood circulation, in normal tension glaucoma, the optic nerve gets damaged even with normal eye pressure due to weak blood flow. In secondary factors, physical eye injury, severe inflammation or uveitis, pigment flakes from the iris or long-term steroid use can trigger the pressure. Then fluid pressure buildup, clear fluid aqueous humor fails to drain and it will increase the intraocular. Other physiology, here you can see the due to the blockage of the aqueous humor drainage, the intraocular pressure increases. So due to the many etiological factors, disturbances in circulation of aqueous humor leads to intraocular pressure, increased intraocular pressure, which damages the retinal layer as it passes through the optic nerve head. Compression on the optic nerve head resulting in cell injury and death, and that will lead to peripheral loss of vision. So fluid imbalance and pressure rise impeded outflow, the trabecular measure blocks or the drainage angle narrows, pressure increases, fluid accumulation raises the intraocular pressure, and optic nerve stress mechanical compression, high pressure pushes against the back of the eye, physically crushing the delicate nerve, optic nerve at the seam like lamina cribrosa, and vascular ischemia occurs. Then axonal transport block, essential survival growth factors fail to reach the retinal cells, cell death and vision loss that will cause the cell death leading to mitochondrial failure to and oxidative damage in the retinal ganglion cells. Then optic cupping and blindness, nerve fibers atrophy and die, creating visible cupping of the optic disc and peripheral vision loss and eventual total blindness if untreated. So clinical manifestations are, you can see the signs and symptoms, that is high intraocular pressure, lacrimation, redness of the eye, fatigue of organ of vision, appearance of bright rainbow rim around any light sources and other objects, pain in the eyes and the eyebrows, headache and blurred vision. So the symptoms of mainly the open angle glaucoma are patchy blind spot in the eye, visual field loss, haziness in vision, see holes around the eye. Then patient with the closed angle glaucoma, you can see high intraocular pressure, headache, redness of the eye, and nausea, vomiting, appearance of bright rainbow rim around and any light sources and other objects, pain in the eyes and the eyebrows, corneal edema and the blurred vision. So the investigations, you can see the diagnostic measures, history and physical examination, gonioscopy, tonometry, then slit lamp examination, optic nerve evaluation and imaging, and visual field testing. History and physical examination is important. Gonioscopy, after local anesthesia and numbing the eye, the contact lens with mirrors are placed onto the surface of the eye. Through the mirror, the eye can be viewed from different directions. So the doctor can see whether the angle is open or narrow or any other abnormality by gonioscopy. The tonometry, of course, we all know, it determines the thickness of the cornea as well as thickness of the cornea can affect the measurement of the intraocular pressure. So tonometry measures the intraocular pressure. Normal is 10 to 21 millimeter of mercury. Slit lamp examination evaluates the front surfaces structures of the eye, revealing a shallow anterior chamber, cloudy corneal fixed or mid-dilated pupil during an acute episode. Then optic nerve evaluation by the optical coherence tomography to know the structural damage or fiber layer loss. Then visual field testing checks for peripheral vision caused by optic nerve damage. Usually this person will have tunnel vision only. They can see only the center part, peripheral vision is lost. Then tonometry measures the pressure of your anterior chamber. Okay. Then treatment medications, eye drops, prostaglandins and beta blockers lower the eye pressure by increasing fluid drainage or reducing fluid production. Medications like carbonic anhydrase inhibitors are used when drops alone are not enough. Laser therapy, trabeculoplasty and iridodermy. So in trabeculoplasty you can see the quick in office laser treatment opens clogged drainage channels for open angle glaucoma. Iridotomy, a laser makes a tiny hole in the iris to help drain fluid for angle closure. Surgical management, it's now mix, that's minimally invasive glaucoma surgery, use microscopic tools and tiny stents for faster recovery. Trabeculotomy, a traditional procedure that creates a new drainage flap to release fluid safely. Then drainage implants, a tiny tube shunt is placed inside the eye to help the fluid to flow out. So minimally invasive glaucoma procedures have been developed in recent years to treat patients earlier and more safely than conventional surgery. Miniaturized versions of trabeculotomy and common types are trabecular bypass tissue removal and micro shunts. So in miniature version of trabeculotomy, in this procedure, tiny tubes are inserted in the eye to help drain fluid from the inside of the eye to underneath the outer membrane of the eye, that is conjunctiva. These procedures include the Sen gel stent, which is FDA approved, and the Perserfal low, that is formerly in focus microshunt, which is available outside US. Common types are trabecular bypasses, tiny titanium pieces like iStent or hydrous open up natural fluid drains. Tissue removal, special microblades clear away the blockage inside the eye's drainage network. Microshunts gel implants like the Sen stent route fluid safely through tiny inner channels. So here you can see the stent, how it is kept. You can see the stents are kept inside the trabecular mesh. So minimally invasive glaucoma surgeries, trabeculotomies and shunts like the Ahmed and Bearwell types have been something of gold standard approach to severe glaucoma. Reliable and highly effective, they are still not minor procedures for those who have to go through them, and each has a number of associated complications. Laser surgery, argon laser trabeculoplasty, selective laser trabeculoplasty, laser peripheral iridotomy, laser cyclophotocoagulation. So here you can see ALT treatment or argon laser trabeculoplasty is the most common form treatment in glaucoma, in the primary open glaucoma. And you can see it is referred as a silent thief of sight. That is the this glaucoma is referred as a silent thief of sight, as it appears without warning. So the ALT treatment opens the fluid channels of your eye, helping it to drain better. So selective laser trabeculoplasty treats again this primary open glaucoma. So SLT works by treating selective cells with low levels of energy. It leaves untreated areas intact and thus can be safely repeated if necessary. Laser peripheral iridotomy, LPI, that it treats narrow angle glaucoma or angle closure glaucoma. This type of glaucoma occurs when the angle between your cornea and iris is too small, which causes your iris to block the fluid drainage, naturally increasing the pressure in the eye. Laser cyclophotocoagulation is an alternative to filtering microsurgery typically used. So in this procedure, different types of lasers are used to inhibit your eye's ability to make the fluid. So, and to lower the intraocular pressure inside the eye. So trabeculotomy is a surgical procedure that reduces the intraocular pressure that exists inside your eye if you have glaucoma. So trabeculotomy is performed by cutting a small hole in the sclera and covering the opening with a thin flap that acts like a trapdoor. This allows the liquid, the aqueous humor, to drain from your eyes. It drains into a blood and a small reservoir just under the eye surface that obscured by your eyelid. A trapdoor is stitched in such a way so that it prevents the fluid from draining into too rapidly. By draining the fluid in your eye, the surgery is effective in reducing the intraocular pressure. This procedure slows down or prevents further damage and loss of vision. Complications, vision loss and blindness, permanent damage can occur. Physically and lifestyle impacts, physical and lifestyle impacts like reduced mobility, increased risk of falls. Potential complications of surgery include excessive drops, hypotony, excessive pressure drops, that is intraocular pressure drops excessively, and bleeding, infections, cataracts or inflammation. Nursing management, acute pain related to sudden significantly elevated intraocular pressure. That is the first nursing diagnosis. Then second, disturbed sensory perception related to increased intraocular pressure and optic nerve damage. Third one is risk for injury related to the loss of peripheral vision and poor night vision or tunnel vision. So acute pain related to sudden significant elevated IOP. The goal is to alleviate eye pain and reduce intraocular pressure to target regions. Interventions: administer prescribed osmotic agents, carbonic anhydrase inhibitors or analgesics. Keep the patient on bed rest in a quiet dark room to promote comfort. Disturbed sensory perception related to increased intraocular pressure and optic nerve damage. Goals: prevent further visual deterioration and help the patient to adapt to existing visual field loss. Interventions: regularly assess the visual acuity and intraocular pressure. Administer prescribed eye drops and ensure the patient can correctly self-administer them. So, risk for injury related to loss of peripheral vision and poor night vision. Goal: maintain a safe environment and prevent the falls. Interventions: remove the tripping hazards, ensure adequate room lighting, and teach the patient to turn their head to relieve the pressure, and instead of relying on peripheral vision, they can have the proper vision. Remove the tripping hazards. Ensure adequate room lighting to prevent falls. Then anxiety related to fear of partial or total blindness and managing long-term treatment. Goals: reduce the patient's anxiety and help them cope with the diagnosis. Intervention: allow the patient to express fear, involve family members in the care, and provide clear, consistent information about their prognosis. Deficient knowledge related to progressive nature of the disease, treatment regimen or long-term medication schedule. Goal: patient actively participate in therapeutic regimen and verbalizes understanding of glaucoma. Interventions: educate on lifelong medication compliance, explain how it correctly wait 5 minutes between the eye drops for maximum absorption. They have to wait, different eye drops will be there. So after putting one eye drop, they have to wait 5 or 10 minutes and then again instill the other eye drops. And they have to reduce the stress, and the importance of regular follow-up is important. Prevention: regular eye examination, managing ocular hypertension, and knowing and managing your risk factors. You have to manage your high blood pressure and diabetes. Use protective items like safety glasses and goggles, which can prevent your eye injuries. Thank you. So today we have seen about the glaucoma. Glaucoma is an eye disease characterized by progressive damage to the optic nerve. Damage in the optic nerve often associated with abnormally high ocular pressure in the eye. The optic nerve damage and impairment of vision are irreversible from glaucoma. So when intraocular pressure increases, the excessive fluid, that is the aqueous humor, is produced in the eye, and trabecular meshwork or outflow drainage of the eye becomes blocked. So untreatable glaucoma leads to progression of loss of vision and irreversible blindness. We have seen the types, risk factors, the causes, the pathophysiology, and the signs and symptoms, the diagnostic measures, the treatment management, the surgical management, and about the health education and complications. Thank you. Thank you for listening. Thank you so much. Thank you.